Hello, everybody. My name is Harpreet, and I'm the kinesiologist here at the Center for Clinical Excellence. And I am going to be presenting on the 3 stages or 3 phases of recovery, a guide to healing and prevention. Thank you so much for your time, and I hope that this information session is valuable to you, and either it's a refresher or you've learned something from it. And at the very end, I'll have my contact information up, so if you have any questions or would like to further discuss anything, you are more than welcome to reach out to me, and I'm happy to answer and or discuss anything that you'd like. So I'm going to go ahead and share my screen so that you can see my presentation. And let's get started. Here we are. So the 3 phases of injury recovery, a guide to healing and prevention. So what is tissue healing? Just so that we're all on the same page, tissue healing is the restoration and repair of tissue architecture and function after an injury or trauma. And this is what we're going to be talking about today. So when we first get hurt, what are the signs? How do we know that we've been injured? And I'm sure all of us at some point in our lives has been. They may vary in degree and severity, but we've all probably been hurt. And the 5 most common signs are pain. One of the first signs that we notice, warmth or heat due to the increase in blood flow to the site. Redness, similarly with the blood flow increase, swelling, and depending on the type of injury, whether if we've broken something or fractured, we may lose our function or have altered function. And a great way to remember the signs of injury is through the acronym SHARP. So S stands for swelling, H for heat, or in this case, warmth, A for altered function, R for redness, and P for pain. So when these signs have now presented themselves, it tells us that we've entered the first stage of healing, and that is inflammation. Inflammation is the immune system's response to injury or infection, and it promotes the start of healing. It can last 2 days or 2 weeks or up to 2 weeks. And during this stage, it is normal to limit exercise and physical activity. We may not engage in our typical exercise routine or engage in our typical activities of daily living because we've been hurt. And that's okay. Our body needs to rest and go through this inflammatory response so that the second stage of healing can occur. So essentially what it is, our body goes into like emergency mode, and it does freak out a little bit. But what happens is there's a whole flood of fluid that goes to the site that's been hurt, and that's because it's delivering things like proteins, white blood cells, so that it can heal and prevent infections or take care of any bacteria that may come in. It's removing debris, and it's creating space so that healing can actually occur. And a great way to think about inflammation is maybe your coffee table broke and you're happen to be handy and you're able to build your own table. So because it's broken, you need to clear the area so that there's room to bring in a new table. And also to know, inflammation gets a bad rep. However, based off a lot of research, it's come to our attention that inflammation is actually very important and it's not a bad thing. Inflammation sets the scene and sets the tone for recovery. And this gets reflected in how we manage it. So usually when tissues have been broken or hurt, they look like this. It's a bunch of hodgepodge. Nothing really makes sense. Nothing's uniform. The muscle fibers that were once together are torn and doesn't really have a whole lot of rhyme or reason. So what are some things that we do right after an injury to help ourselves? And the most common way that people manage their inflammation is the RICE. So R stands for relative rest. And relative rest is important. So if we can still move our body in other ways, we still want to do that. Resting the part that's hurt, but moving our other parts of our body. And the reason for that is when we move, there's increased blood flow. And we need blood flow to the site that's been hurt because we're able to deliver things like nutrients and oxygen to the site and clearing away debris and carbon dioxide. People may ice, whether that's for pain or swelling. They may choose to compress that site, again, to help with swelling, or elevate to reduce the swelling. And just to note, if you go with elevation, we want to make sure that whatever part that's hurt, we want to elevate it above the heart so that swelling can actually come down. However, there's been so much research, and based off all that new research, a new acronym has come out on how to manage inflammation, and that is PEACE. So let's see what the differences and similarities are between PEACE and RICE, and why those changes occurred. So starting off with protect, we still want to protect the site that's been hurt, whether that's through immobilization, or maybe you need to put a bandage on it so you don't get infected, whatever it may be. Still want to protect the site that's been hurt. We want to continue to elevate because this is a great way to help reduce swelling that's going to be occurring. And a new one is avoid anti-inflammatories. So because we now have learned just how important inflammation is, when we take anti-inflammatories, we don't actually get rid of inflammation because we need inflammation. It's going to happen regardless. However, when we take anti-inflammatories, it actually suppresses the inflammatory response. And so instead of making it go away, it actually lengthens the amount of time that inflammation is now taking place. So instead of maybe 2 days of inflammation, you may be looking at 3 to 4. So it just takes longer for the site of injury to heal. Now, that being said, just because here we're saying avoid anti-inflammatories, if you're in a lot of pain or swelling is really bad and you need to take an anti-inflammatory, of course, by all means, it makes sense. It's just now maybe we want to think twice about taking it before we actually do. We want to continue to compress because it's a great way to reduce swelling, and we want to educate ourselves. And I really like this one because a lot of people think inflammation is really bad and it needs to be taken care of or gotten rid of somehow. And that's not the case. So when we know just how important inflammation is and what it does and how it sets up the second stage of healing, it reduces some of that anxiety and panic that can come up when people notice that they're now inflamed. So this is a great way to help now manage inflammation. And you'll notice that ice isn't on here. And the reason for that, ice is similar to anti-inflammatories in that it helps reduce the swelling, but we need that swelling to occur. So when we ice our site of injury, what it does is it vasoconstricts. And basically what that means, it makes the diameter of our blood vessels smaller so that there's less fluids going to the site that's been hurt. But because of that, we have to remember blood carries nutrients and it carries oxygen and proteins. And those are all essential things to heal whatever's now been hurt. So when we ice, or at least ice frequently, it slows that process down. But again, similar with the anti-inflammatories, if you're in a lot of pain or you need to ice whatever's now been hurt, then yes, go for it, maybe 10 minutes at a time. It's just that we want to think twice about one, if we choose to ice, and then how much we're icing. So once inflammation has done majority of its work, it's going to slowly channel into proliferation, which is the second stage of healing. And proliferation starts a day or two after injury and can last 3 to 4 weeks. There are many, or there may be some overlapping of the inflammation and proliferation phases simply because it's a spectrum. Healing is a spectrum and not hard stages. And this process is fast and the body moves very quickly. It's imperative to make the changes that we want during this stage, or we lose out on what we call the golden time or the golden period. If we don't participate in certain things or engage in certain interventions during the stage, we lose out on a very good opportunity. So proliferation, going back to our table example, is inflammation clears out the broken table. Proliferation is now bringing in tools and new equipment so you can build a table, and you're getting the framing done of the table in this stage. And so during this stage, debris from the injury site is continuing to be cleared out. New and stronger cells are being laid down and forming new tissue. Tissues are knitting together to mend the injury. And in inflammation, things are all hodgepodge. They don't make a whole lot of sense. However, by the end of proliferation, if you've done all the right things start to look cleaner, more uniform, and the way that they probably should be. So some symptoms that people may continue to feel during this stage is weakness, stiffness, reduced range of motion, swelling, muscle tension, and pain. However, the severity of these symptoms may be reduced compared to inflammation. So what can we do to support this phase so that the cells lay down the way we need them to? We exercise. And I'm not saying go do some crazy workouts or go back to exactly what you were doing despite the fact that you're now hurt. We want to gradually introduce exercise, slowly, gentle exercises to start with. And then as your tolerance increases, you're adding more to it so that we can prevent re-injury and make sure that you heal the way you need to heal. So how does it help? It teaches and guides our body to lay down cells the way we need them to. So remember, in inflammation, emergency mode. Our body is bringing in cells, it's trying to patch things together, but it doesn't care how it's actually getting patched together. It just wants to do a job so that it's taken care of, and the danger part of it is now being taken care of. However, during proliferation, we don't want that hodgepodge mess to stay. We want to clean things up so that our body is now efficient and able to function the way we need it to. So again, hodgepodge mess and inflammation. And then when we exercise and when we're loading or doing certain movements, it tells our body, oh, she actually needs to stand. So I better lay down cells this way, vertically, so that she's able to weight bear. So a great example of this would be, let's say you hurt your thigh bone, your femur, and for the most part, inflammation has come down and it's time to start moving a little bit. So you decide to stand a few minutes here or there, but that standing, what it does is it tells your body, oh, she's standing, the bone is vertical, so I need to lay down cells vertically so that it's actually going to support her weight versus horizontally or at weird angles that don't really make sense. So that is what exercise does, and that's just an example of it. So how do we support this stage? We use another acronym because we love acronyms, and it's LOVE. That's how we remember it. So we want to load our body, whether it's body weight or as you get stronger, you start adding different weights so that you strengthen the muscles around it. But we want to start loading because it's a cue that tells our body how to lay down cells. Optimism. And this can be sometimes difficult, especially with injury recovery. It could be because the injury recovery is taking longer than you would like. It could be that maybe you had some really good days and now you flared up. Or it's just taking a lot of patience and there's a lot of pain involved, and it can be discouraging. So educating yourself in the process of injury recovery and practicing optimism and at least coming back to it whenever you possibly can, that positivity is going to help with the mindset, and that positive environment and those positive feelings and thoughts are going to help with the healing. We want to have vascularization occur. And basically what that means is we want blood flow, we want blood vessels around the site of injury so that we can perfuse it with a bunch of oxygen and nutrients and get rid of the waste and carbon dioxide. And that all comes with exercise. So exercise, we load, we can vascularize, and it's great for mental health because of all those feel-good hormones. So it assists with optimism. So what happens if we don't introduce exercise at the right time? It makes recovery much, much harder. So when we don't engage in exercise during the second stage, so that golden period, it slows the recovery down. Because regardless, your body is meant to heal. Our bodies are meant to restore, recover, and heal. However, if we don't engage in exercise, we can heal painful. We can heal up stiff, we can heal up weak, we can heal up with reduced range of motion, but you're technically healed. So if we don't engage in exercise, we're going to still continue with, our bodies are still going to continue with the phases of recovery, and we enter into the third stage, maturation or remodeling. So maturation or remodeling starts after about 3 weeks of the injury and can last up to 12 months. This is when our cells are being broken down and new cells are being laid. And body adds finishing touches to it. So going back to the table, after proliferation has occurred, now you have a top, you maybe have 4 legs, but in the third stage, we want to make it look pretty. We want to get fancy with it. We'll probably sand, or maybe add some designs, maybe add some paint or polish, so that it looks more presentable. And this process is slow, very slow. So if we started exercising in this stage compared to the second stage, would the adaptations be quick? No. No, it's not, because the process is slow. And so what ends up happening is sometimes people, they want to wait till the pain goes down. And for them, that's the sign. Okay, now I can start moving, I can start doing exercise. However, it doesn't quite work that way. If we wait by the pain to go down, that could take many weeks, maybe even some months. And by then, our golden opportunity to make those changes has already gone. And this can actually set us up for chronic pain. We've already entered the third stage of healing. And if we were to start trying to make adaptations now, they'll still occur because you're making changes to your body. It's just that it's going to take much, much longer for them to actually kick in. And this time or this period, it can be challenging to practice optimism compared to practicing optimism during the second stage of healing. And our bodies are always remodeling because we don't have the same cells and tissues as we did when we were babies or 10-year-olds or 20-year-olds. Our bodies are meant to be in optimal condition and they want to be better. It just needs some guidance and care. And we tend to become our own barriers. And so when we educate ourselves with how our bodies are meant to heal, we can, get help, whether it's through physio or kinesiology or getting some advice from your healthcare practitioner. We can then appropriately engage in certain interventions at the right time so that we heal at a faster rate and we heal better and stronger. So to summarize, our tissues, tissue healing is the restoration and repair of tissue architecture and function after an injury or trauma. There are 3 stages of recovery: inflammation, proliferation, maturation, remodeling. And focusing on implementing exercise during the second stage of recovery is key to fast healing. If that is all you take away from here, wonderful. So again, remember, you don't have to engage in a whole bunch of exercise or very hard exercise. Just gentle to start with, and then building up your tolerance as your capacity increases. Our bodies are wonderful and we need them to heal so that we can engage in activities that we like to do and we want to do. It's just sometimes we need some help. Thank you so much for your time. I really appreciate you joining me tonight. And I encourage you all to check out our website, vfrh.ca, so that you can see the services that we provide. And again, if you have any questions or would like to further discuss anything, my contact information is up there. You're more than welcome to reach out, and I encourage it, and I look forward to hearing. Thank you so much and have a great evening.